Hello, everyone. I'm Robin Merritt. I am the Lawrence-based advisor for the School of Health Professions. As many of you already know, the School of Health Professions is located on the Medical Center campus in Kansas City, Kansas. But my office is here on the Lawrence campus in the Undergraduate Advising Center because I work with any student who's thinking about a health professions program or is actively pursuing a health professions program but hasn't yet been admitted into their program. The purpose of this academic information meeting is to give you a broad overview of our programs because we have many, and we have many that no one's ever heard of. And so I think it's important that you're making an informed decision when you're thinking about your major. So let's go ahead and get started. So the first question I almost always get about the School of Health Professions is, what are they? Which is fair because it's a fairly ambiguous name. And an easy way to think of us is we are any health professional other than doctors, nurses, or pharmacists. We are what used to be known as the allied health professions, and we include things like physical therapy, occupational therapy, audiology, respiratory care, health information management, and lots of other ones. So we're going to start by giving you a bird's eye view of our programs because we have health profession programs at all different levels. To begin with, we've got undergraduate programs in clinical laboratory science, health information management, and respiratory care. We've got graduate programs in audiology, speech-language pathology, molecular biotechnology, dietetics and nutrition, nurse anesthesia, occupational therapy, and physical therapy. And we even have certificate programs, which are non-degree granting programs that really get you ready to sit for state or national boards. And these are all of our diagnostic imaging programs. They are cardiovascular sonography, analyzing and reporting information vital to the healthcare industry. We see HIMs in lots of different locations: hospitals, clinics, corporations, insurance companies, federal agencies. Really anywhere there is a group of health professionals, there is likely to be a health information manager to help manage all the data that the other health professionals produce. Because this is the business IT side of health, little to no patient contact because typically you're with the IT professionals or you're in the business professionals, but certainly you're in an office somewhere, you're not actually meeting with patients for the most part. Our last undergraduate program is Respiratory Care. They diagnose lung and breathing disorders. They analyze breath tissue and blood specimens to determine levels of oxygen and other gases. And they act as first responders for patients who have stopped breathing. We see respiratory therapists in lots of different locations: hospitals, sleep labs, patient homes, clinics, and ambulances, particularly air ambulances, because if you're on a life flight helicopter, you're probably not breathing very well. And so we want an expert in the helicopter with you to get you to the hospital. This is the profession that I think of that's most like nursing as far as that one-on-one patient contact. But whereas with nurses could potentially be working with any part of the body, respiratory therapists are only working with patients' chest, neck, and head because they're only working with patients who aren't breathing well for a variety of reasons. Let's move on to our graduate programs. Because they are graduate programs, they will require an undergraduate degree of some sort. Some have very specific requirements, some really have no requirements at all, and we'll talk more about that as we go through each program. Our first two graduate programs are audiology and speech-language pathology. Audiologists diagnose and treat hearing and balance disorders, whereas speech pathologists diagnose and treat communication and swallowing disorders. So an example of what an audiologist does is, if you remember when you were in elementary school, you might have had someone come and put headphones on you and you raised your hand when you heard a little beep. That was an audiologist. They don't just do that. They do lots of other things. Really, anything having to do with hearing and balance disorders, they are involved with. An example of what speech pathologists do is if you had a lisp or you stuttered when you were a child, you may have worked with a speech language pathologist to help you communicate a little bit more clearly. Because these two graduate programs have very specific classes you have to take, and there are 9 of them. Most students will get a major in speech, language, hearing sciences, and disorders because those classes are included in that undergraduate degree. You can also get a minor in speech, language, hearing sciences, and disorders and get most of those classes, but you will get all of them with a major. So for that reason, most students will choose to get an undergraduate major in speech, language, hearing. Let's move on to molecular biotechnology. They are very much involved in research and development of drugs, vaccines, therapies, and diagnostic tests in a variety of settings. So this is the graduate arm of clinical laboratory science. And if you remember correctly, those are the ones that learn to do 1,000 different tests in the lab. Molecular biotechnology I think of as going the next step in learning basic research techniques so that you can develop new drugs and vaccines and therapies. Because it's the graduate arm of clinical laboratory science, as you can imagine, it's also completely lab-based. And this one has fairly specific requirements as far as your undergraduate degree. You must get an undergraduate degree in clinical laboratory science, biology, or chemistry. Our next graduate program is Dietetics and Nutrition. They advise people on what to eat in order to lead a healthy lifestyle or achieve a specific health-related goal. So you may go to a dietitian or a nutritionist if you are trying to lose weight, or if you are diabetic, for example, and trying to control your diabetes through nutrition. There are so many health issues that can at least be helped through nutrition. So dietitians see lots of different people with lots of different diagnoses. Several of KU's dietetics graduate program, and we have quite a few at the graduate level, have no preferred undergraduate major. However, if you want to be a registered dietitian, you must get an undergraduate degree in dietetics, and KU does not have this major at the undergraduate level. Many years ago, the Board of Regents decided that KU should have the graduate portion, whereas K-State should have the undergraduate dietetics program. So for that reason, if you wanted to be a registered dietitian, the closest school you would have to go to first would be K-State, and then you would come to KU for the graduate portion. Let's move on to the nurse anesthesia program. As the name implies, it's a nurse who specializes in the administration of anesthesia, the gas passers, if you will, when you're having a surgery or a procedure. This particular graduate program has very specific requirements. You must get a Bachelor's of Science in Nursing degree. You must be a registered nurse, and you must work for at least 2 years as a registered nurse. One of those 2 years has to be in an acute care setting, so something like an intensive care unit, a NICU, a PICU, something like that. The only other difference between the bachelor's requirements and the nurse anesthesia requirements are the chemistry. The Bachelor of Science in Nursing only requires 1 semester of chemistry, whereas the nurse anesthesia program requires 2 semesters of chemistry. But everything else is exactly the same. Let's move on to occupational therapy. They help patients develop, recover, and improve the skills needed for daily living and working. They're very much interested in their patient's environment because they're working with patients who have an injury or disability that is prohibiting them from living life to the fullest. And so an occupational therapist will come in and help them modify their environment so that they can live as independently as possible. So, for example, an occupational therapist might recommend a buttonholer tool for someone who doesn't have fine motor skills in their dominant hand any longer. Or they might recommend a shoehorn on a long rod so that someone who can't bend over very well can still put their own shoes on, and lots of other modifications as well. Occupational therapy has no preferred undergraduate degree, so you can major in anything, and I have seen every major under the sun go to OT school, so really go with your interests. Having said that, students tend to self-select psychology and applied behavioral science as their undergraduate majors, and that makes sense because both of those majors help you work well with a wide variety of people. And our last graduate program is physical therapy. They evaluate the functioning of multiple bodily systems and apply the appropriate treatment to alleviate pain and improve physical function. So whereas OTs were all about their patients' environments, PTs are all about their patients' bodies and exercising and strengthening whatever's not working well so they can do whatever they need to do as independently as possible. Physical therapy, also like occupational therapy, has no preferred undergraduate major. And again, I've seen every major under the sun go to PT school and be very successful, so go with your interest with this one as well. Having said that, students tend to self-select exercise science as their undergraduate major simply because it includes all of the sciences that you need to go on to PT school. So it's the easiest route. It may or may not be the best route for you. Let's move on to our certificate programs. As I mentioned before, these are non-degree granting programs that allow you to sit for state or national boards, and these are all of our diagnostic imaging programs. Our first certificate program is cardiovascular sonography, and they use reflected sound waves to image the structures of the heart in real-time motion. So if you're having a sonogram of your heart, you can see the heart muscle moving, you can see the blood going through the different chambers. It's really kind of cool. This particular certificate requires a bachelor's degree or an associate's degree, and an emphasis in science is preferred. Our second certificate program is Diagnostic, Ultrasound, and Vascular Technology. They utilize high-frequency sound waves to assist in the diagnosis of a variety of conditions. They're the ones that if you're pregnant and having an ultrasound, they do those, but you could potentially have an ultrasound on many parts of your body, so you're not just hanging out with pregnant women all day. This particular certificate program has a very specific degree requirement before starting the program, and that is completion of a 24-month radiologic technology associate's degree, which KU does not offer. Those are typically at community colleges, and they're actually very easy to find, certainly in this area. But you have to have that 24-month radiologic technology associate's degree before you can start this program. Our last certificate program is Nuclear Medicine Technology. They operate equipment that detects and maps a radioactive drug within a patient's body to create diagnostic images. So depending on what the doctor is looking for, the drug might be injected or the drug might be swallowed, and they follow that through the patient's body to determine, is it going where it's supposed to be going? Is there a structural abnormality, or is something blocked or leaking? This particular certificate has several options as far as what you need to do before you start this program. They're just very specific. You need to have a bachelor's degree in a healthcare or science field, or you need to be a registered radiology technologist. or you need to be a diagnostic medical or cardiac sonographer, a certified medical technologist, or a registered nurse. So like I said, lots of options. They're just very, very specific. So now that you've heard about all of the programs the School of Health Professions has to offer, let's talk about applying to your program. You're admitted to KU as a pre-student in the College of Liberal Arts and Sciences, so you would be pre-respiratory care, pre-health information management, pre-occupational therapy. And it makes sense that you're admitted into the college because 99% of the classes you'll be taking for your program are in the college. For undergraduate programs, you will officially declare your major when you apply and are accepted into your program during sophomore year. For graduate students, you will apply the summer between your junior and senior year, and all of our programs have an application process. So some common application characteristics: all of our programs are competitive, and what that means for you is just because you meet minimum requirements doesn't necessarily mean that you'll be admitted into your program. All programs recommend or require healthcare experience, and I mention that now because that's something you can start working on now if you want to. I do recommend starting on it sooner rather than later, because if you start on it sooner, you can complete just a couple hours a week and have lots of hours of experience by the time you apply for any of these programs. All programs require that your pre-admission coursework be done by the time you start your program, not at the time of application. And that's important to know because you're applying for a lot of these programs a year before you want to start. So if everything had to be done at the time of application, what would you do for a year? So just remember that you just need to have everything done by the time you start your program. And all of our programs require letters of reference. Again, I mentioned that here at orientation because you may have a fantastic instructor your first semester that you've gotten to know well, you have a great connection. They could potentially be a really good reference for you later on. So just keep that in the back of your mind as you're going through classes and getting experience. You made it to the end. Yay! I've put all of my contact info on here. Please, please, please contact me anytime you have questions or concerns. I am always happy to talk about School of Health Professions programs and answer questions about them. So thank you for your attention. I appreciate it very much, and I'll see you on campus in the fall.